Well, good afternoon, everyone. I'm Robert Greenhill, the Executive Chair of Global Canada. And this session is in the next 90 minutes going to look in detail at reopening the U.S.-Canada border. What does this mean? What will it take? And when will it happen? Although the Canada-U.S. border has been closed since spring 2020, economic trade and critical supply chains have been maintained. However, discretionary travel has dropped some 90%. There's increasing pressure from business groups and families that have been separated and others for a broader and more rapid reopening of the border. How should decision makers balance a desire to restore discretionary travel with the danger of new vaccine-evasive variants that could be carried even by fully vaccinated travelers? How do different proposals for reopening compare? Do Canadian and U.S. perspectives differ? I'm delighted that we have with us 5 very thoughtful experts in this field to share different and we think potentially complementary perspectives on this. To start, let me introduce Laurie Troutman, Director of Border Policy Research Institute, Western Washington University. Laurie, welcome, and we're looking forward to your thoughts.
Hi, everyone, and thanks for having me today. Robert, I'll keep an eye on you to wave at me if I exceed my time limit, but I think I can be pretty succinct. My main point today is that there is really a long tail on this dog, and the dog being the restrictions here. The lack of engagement and innovation and political urgency around these restrictions until really just a few weeks ago to develop a plan has major costs. And I emphasize plan because we can debate how quickly we should reopen the border. And I think this conversation will evolve to that. But I guess I want to lay the groundwork and just say the plan alone is incredibly critical, and we still really don't have one. We're beginning to see inklings of sort of a one-sided plan, but really nothing concrete from the US at all, and very little from Canada, to be frank. So every day that the border is restricted, we continue to have mounting economic and social costs. And I live adjacent to the border. I see these every day in my own community, and they're getting worse. They're certainly not sort of going away just because the border is sort of become a new normal. And I also want to stress that these impacts are uneven and they really vary by industry and location. And from the research and the work that I've done, I find that many of these impacts fall disproportionately on small rural communities. That's particularly true in Washington State, in the area between British Columbia and Washington State. And a lot of the impacts fall on smaller businesses that have built up these niche industries around cross-border travel that's essentially dried up for over a year now. And then, of course, there's the people who can't be with their loved ones in time of need. And what these people are seeing is that hockey players are able to go back and forth across the border. And that's become very frustrating, as you mentioned, Robert. I also think there's a bit of a misconception that commercial cargo and trade is sort of business as usual and unaffected by the border restrictions. I don't think that's the case. I think a lot of the trade relationships that we're seeing now and a lot of the supply chain logistics are the result of business negotiations that could be done before the border restrictions were put in place. And we've certainly heard a lot of industries speak out to say that if they can't do site visits, if they can't engage in these personal business negotiations, there will be impacts down the road that perhaps we're starting to see or haven't quite seen yet. So moving forward, I think this panel is sort of about how do we move forward, not necessarily how do we look back. Again, I think the plan itself is what is so critical for people that are impacted by the restrictions. And not having that plan enables or prevents businesses from thinking about, will August be a time when there is some cross-border travel? Should we be ramping up if we're in the tourism industry? That's a complete unknown. And then for families who really have suffered mental health impacts from these restrictions, it's devastating. And I say that, I hear from multiple people quite often saying, is there any indication of what sort of metrics there might be so that I can stop looking at every single tweet and every single news piece that comes out? It's like I'm chasing my tail, trying to figure out if I'm going to be able to visit my husband by the end of the summer. And so, not having that structure is, I think, where we really failed on both sides of the border. And it's not as if these structures haven't been proposed. The Future Borders Coalition, which is a binational coalition of over 50 member organizations in Canada and the US, quite some time ago proposed a phased, scientifically based easing of restrictions. Canada's Ministry of Health report, which came out, I think, just in early June, also recommended this phased approach based in science and suggested that fully vaccinated travelers should be able to cross the border regardless of trip purpose or nationality. And I also want to highlight that, since the restrictions were put in place, millions of people have crossed the Canada-U.S. border, and we've tolerated that risk for what we consider to be essential. But those people are not necessarily vaccinated or tested. So we have had this level of risk this entire time that's sort of, I really think, been pushed aside and said that that's okay because it's essential. But now we're at a point where we should be able to allow vaccinated travelers, regardless of trip purpose, to cross the border. And actually, that would be less risky than what we've already been doing with essential travelers. So my main point in closing is just to say that we really need to move away from a system where border officers are deciding what is essential and what isn't. And we need to move to a system of what is safe and what isn't. And now we have enough vaccinations. We have pretty similar caseloads on both sides of the border that we should be moving there much more quickly, I think, than we are. And this is what the Ministry of Health has recommended in their report. So how we do that, there's a big question. There's been a couple pilot projects that were done over the past year by the Government of Canada that produced some really valuable data on how the virus is actually spread across international borders. I run a research institute where we are constantly doing pilot projects to prove broader concepts. And this is a place where, again, yesterday we should have been given the authority to do some of these pilot projects to test out how do we share vaccine records, how might this work better. And instead we're sort of just starting that out now. So we're at a better place than we were a few weeks ago, but there's still a lot of unanswered questions. And I do think that there are ways that we can get to where we need to go safely and efficiently by being innovative and working together. So that's it for me, Robert.
Great, thanks, Lauren. And I think the point that, why is it that big businesses and hockey players and so-called essential workers have been able to benefit in a way that others haven't, even when at times it was much riskier than fully vaccinated potential travelers today. And the point that what we need is a plan. We can debate the elements of it, but we need clarity on what might the phases look like and what will be the preconditions and what would be some of the elements would adjust it. Theresa Cardinal Brown, in your role as Managing Director of Immigration and Cross-Border Policy at the Bipartisan Policy Center in Washington, you've thought long and hard on the issue of the logistics and the operational challenges. So if out of this, with leaders on both sides of the border, doubtless listening to our panel, if they decide to take up Laurie's challenge of let's put forward the plan, what do we need to see in that plan, Theresa, for this to be effective and timely?
So thank you very much, Robert, and thanks to Metropolis for inviting me. I think we have experience that we can look back to, and that experience includes the closing of the border after 9/11, right? The thickening of the border and the years of negotiations over the decade that followed about how to reopen the border and manage risk. How do we manage risk together? And we've had previous health incidents that crossed the border, everything from SARS and bird flu and H1N1, and we managed to figure out how we worked it together. What seems very different to me this time around, and I'm no longer in government, but I'm from the outside, is that although there was mutual agreement for closure, there hasn't been that same level of engagement of managing this pandemic on a cross-border basis. And I'm sure there's relics of the friction between the Trudeau government and the Trump government on that, but many of the structures that were put in place that were far down at the working levels in government agencies seem to have become somewhat moribund. And that's devastating if we're trying to manage reopening a border. So we first need to re-engage, and we need to re-engage at multiple levels and not just wait for the leaders to pick up the phone and call each other. There needs to be conversations happening at every level of government and between multiple ministries and cabinet departments. So, Health Canada needs to be talking to HHS, and Public Safety needs to be talking to DHS. And we need to know what is going on both sides of the border. But one of the complicating factors for the United States, and we can't ignore it here in a North American forum, is that we are looking at border issues on both of our borders, both the border with Canada and the border with Mexico. And the issues always have been somewhat different, but there are lots of similarities. The clamoring for reopening the border to casual travel is happening on the US-Mexico border as well. So I don't want it to seem as if all of the push is coming from our northern border neighbors. There's a lot of communities on the US-Mexico border who have also felt the pinch from the reduction in cross-border trade and travel to essential services only. So I think, and then there's sort of the approach that both countries took, like, okay, we agreed sort of on what each side thought was essential services, but the parameters under which people could cross, the exemptions were very different between Canada and the United States. The strictures going into Canada were much more severe than the strictures coming south into the United States in most cases. And that created difficulties and confusion amongst a lot of the public that would normally cross back and forth. I can share a very brief anecdote. My sister-in-law and my husband and their sibling own a cottage in Quebec that we have not been able to visit for 2 years. She is a Canadian citizen with a US green card. This summer, she was finally able to cross the border. She prepared weeks in advance. She had a binder full of information, her entire quarantine plan, who was going to bring her groceries, copies of property records and Hydro-Quebec bills that showed that it was her property that she was going to tend. She put all this together. She had to get a test 72 hours before she traveled and had to make sure she had the results in hand in order to cross the border. She didn't know whether she could get it on her phone or had to get it printed out. When she ended up getting to the border, and she normally would go Pennsylvania, New York, Quebec. She went Pennsylvania, New York, or Pennsylvania, New York, Ontario, Quebec. She went through Quebec because Ontario was still on lockdown. So she went across at Champlain, and the border officer looked at her binder and said, "Don't worry about it. Here's your test. Go send it in." So it doesn't, in some ways, it doesn't even matter what the rules are because it's being implemented kind of randomly across the border, and that's problematic too. So when we talk about operationalizing, and I like that Lori said we have to have a plan, there's lots of levels to this plan. The governments first have to agree on what are the conditions under which we can start reopening. What does the science say? Start with the conditioning. What's the conditions under which to reopen? And then what does the reopening look like? What kinds of phases? What are we looking for? What kind of training do we need to provide our border officials? What kind of public information do we need to get out there so people understand what the new rules are? You can't willy-nilly change things quickly because it creates mass confusion. And that ideally should be done jointly so that both sides are saying the same things at the same time. So it's difficult. It's a challenge. I absolutely get that. And I know that some of our other panels are going to talk about like what happens if we have upticks and we have to close down again. What I would say is that this plan needs to contain both opening and reclosure parameters because it may happen. We need to plan for everything. Hopefully we won't have to, but we need to plan for all of that. And the sooner we can start regularizing binational conversations at those levels in the ministries and departments, the sooner that plan can be put in place and we can look at reopening. I don't know if there's sufficient conversations happening right now that July 21st, which is the day people are throwing out when the latest closures are due to either be renewed or extended or closed down, is enough time. It can be if everybody is working at warp speed, but I'm a little bit skeptical. I think it may be closer to an end of summer thing. And I know that that's devastating for people who usually travel during the summer. The other thing is to bear in mind that we're ramping up from a far reduced cross-border flow to a potential very large cross-border flow quickly. So staffing, operational hours, and in particular, making sure that our border officials are protected and that they have sufficient protocols in place so that they feel safe with an increased flow of traffic and travel is going to be important as well. So again, I think that we have a roadmap of how to do it. We as countries have done this before. We kind of need to get those muscles going again in terms of cross-border collaboration and think about it from that operational perspective as well as the policy level.
Fantastic. Well, thank you very much. And Theresa, the element of that it's not even happening at the working level is actually quite sobering, that it's not just at the political level. And this idea of the need to prepare for the surge. so that we don't actually get overwhelmed as we've seen it in other areas. One thought we can maybe get into too is the issue of can you differentiate where will be the greatest areas of incremental benefit? This issue of family reunification or people actually with property on the other side of the border being able to visit it, it may be that by relaxing some of these elements, you actually get a tremendous economic or mental health benefit as well. In terms of some of the challenges of this, you had mentioned, or Laurie had also mentioned that there had been a panel looking at this, an expert advisory panel on some of the border testing. But one of the things you mentioned was a lot of these things have been done kind of quietly, and that was an example of where there was some excellent work done, but it was done kind of quietly and then kind of pulled out of a hat without any kind of a review process. And I think one of the things that's very important is that we're very clear on what are the benefits, what are the risks, and therefore what is the right balance of approaches. Kelley, you've been playing a key role in your role as Professor in Canada Research Chair at Simon Fraser University, and also the leader on, or co-leader of the Border and Pandemics research group. Could you please share your perspectives on what you see as some of the key health challenges and potential risks, and also some practical ways these may be able to address in this plan that needs to be built?
Sure. Thanks, Robert, and the organizers of the conference as well. I really appreciate this opportunity. So yes, our Pandemics and Borders project group has been looking at every country in the world, not just Canada and the US, and how travel measures and border management has been taking place over the last 18 months during this pandemic. It is an absolutely complex policy area, a bit of a mess. I think everybody would agree. And so it's an unprecedented situation, but I think there is a kind of starting point for a path forward with vaccination. So with your permission, I'd like to just share my screen and give you a sense of what we've kind of been learning and why it is so complex to put this plan together, because I know people are keen for the time frame and so on, but I just want you to appreciate why it is maybe people are feeling, it's difficult to put very clear parameters. So let me just start with an analogy that my colleague, Carolyn Kelley, who's a mathematical modeler, she looks at infectious diseases, and she's been modeling here in Canada a lot of the things that have been happening. And she uses this analogy of a wet forest. So we're in a situation increasingly that we're creating this wet forest, which means really that we're vaccinating enough people so that every infection that comes into the population could fall in a wet forest and not cause an outbreak. So before, we had nobody who was immune to this virus, and we had very much a dry forest. So any spark could cause a potential forest fire. So we're moving along, and that's the good news, in that we're vaccinating at pace, in both countries. And if you look at our trends, what you're seeing is really that the US roared ahead in terms of vaccinating with one dose, and now increasing fully vaccinated population around 50%, 60%. Canada is slowly catching up, quickly catching up. So at some point during the summer, we will hopefully catch up, and then even may surpass the US in terms of fully vaccinated, because of course, vaccine hesitancy is higher in the US than it is in Canada. So that's the good news. We're moving forward, and you can see the dates up to June 24th. What we're predicting really is that, we won't get full vaccination for about 70% of the population till the end of the summer, 75% perhaps. So the time frame, I think maybe Laurie or Theresa mentioned, is right. We won't get to that point quite yet in the next few weeks. The key, I guess, curveball is the variants of concern. And so they just keep coming, don't they? The latest, so we're hearing about the Delta variant and now the Delta Plus variant. And that is the variant that's behind what we've seen in terms of the tragedy in India, in Nepal, Southeast Asia now, and parts of Africa. It is roaring in terms of surging infections. It is really quite worrying. We're also seeing, of course, a surge in cases in the UK, where there's a high level of full vaccination. And it's comparable to Canada and the US. We're also seeing it break through in places like Israel. So it's something that we really need to keep an eye on. I believe it's about 10% of the cases now in the U.S. It's very much concerning for all countries, especially those who are unvaccinated or partially vaccinated at this time. So why it is a concern is, of course, because they're circulating globally, these variants, but also that they're amplified because most of the world is not vaccinated yet. So we are in a privileged position to be two countries that are, but the rest of the world is not in the same place. And so we can, other than, cutting ourselves off from the rest of the world, which is not a possibility, we do have to still think about this cross-border issue from a global perspective. This is not just a bilateral issue. And of course, it's not just the Delta variant, it's whatever comes along in the next while the virus is circulating in such a high level, that variants will continue to appear. The particularly worrying thing about Delta is that what we're seeing is breakthrough infections. So that means that people who are fully vaccinated are actually becoming infected with this Delta variant. And so this is a study from Qatar, which they looked at arrivals by air into the airports, and they broke down the different, people by whether they were vaccinated or partially vaccinated or had immunity from previous infection. And what they found was basically that a certain number of people who were fully vaccinated were still coming in and being tested positive. So that is something that people have been picking up around the world. And this is another study from Singapore, where what you're seeing is that even larger number of breakthrough infections are occurring. This happened through travelers coming from South Asia into the airport and infecting airport staff. So this shows that, the green dots are the breakthrough infections, and they're then causing onward infections in unvaccinated people or partially vaccinated. So, those are epidemiological data that really does factor into whether you can make this kind of clear timeline when things like this are happening on a real-time basis. So what does this all mean for reopening the Canada-US border? Well, the first key message is that we have to continue to vaccinate at speed, and to get the fully vaccinated number of people up to what we previously thought was actually 75% is now probably 90%. And that's going to be a huge challenge. I don't know if either country can achieve that, but the numbers have moved because of the way the Delta variant is behaving. What that means in terms of good news is, of course, that we have less likelihood of severe illness and less likelihood of death, but we do need to get those vaccinations up. Of course, we can't vaccinate children at the moment. That is something that people need to take into account. If we're going to be reopening a border with the Delta variant circulating and we have no children vaccinated, this has to be a concern for every parent out there in terms of the risks that are caused. But we keep going. We also need to, of course, get those vaccines out to the world. And the G7 has discussed that, but it's been a slow process since those meetings a few weeks ago. We need to move faster. And the sooner that we can get the rest of the world vaccinated, the sooner that we can get those variants less likely to emerge. So that's the key thing. But so assuming that we get to the point where we've got a high level of vaccination in both countries, full vaccination, we did have what Robert just referred to as this expert advisory panel, which put forward some protocols for how we could move to a system where we have an immunization-based screening process. So according to this panel, they divided people into 5 categories: fully vaccinated, partially vaccinated, fully vaccinated, people who have been previously infected that can maybe have antibodies, and then these exempt travelers, which you've already touched upon, which actually are quite a considerable number of people. What is interesting about their recommendations, and then they allocated testing and quarantine according to the risks that the panel thought would be posed by these people, and then that would allow people to come into Canada in a safer way. So they would test perhaps, and treat people who are unvaccinated in the same way they are now. They would have to be tested multiple times. and then quarantined. But people who are fully vaccinated would only have a certain number of tests and probably don't need to quarantine after they've had a negative test at the border. So people are putting forward these different protocols. What's interesting is CDC, the US CDC has put forward also protocols. They don't match, for one thing. So that's a problem. You know, if you have one country doing some things and other countries doing other things, that's hard for the traveler, but it's also, you know, we need to manage risk in the same way. And that is not just in the US and Canada, but of course, around the world. Every country is doing things differently, testing and quarantining people differently. So ideally, we need those aligned. And that's very important. But the more important point really is that those protocols need to be very much risk-based. And at the moment where this advisory committee actually put forward its recommendations before the Delta variant was around. So we need to adjust those protocols. So we've been thinking about this a lot in relation to how we do that to match the risks that we have now with things going forward and how we treat people if we do end up easing. So based on our understanding of the evolving science and the epidemiological data that we're analyzing as we go along in real time, this is what we're recommending. It's slightly different. I know it's a little hard to remember what was on the other slide, but essentially what we're saying is because of these breakthrough infections, we do need to do more testing than people probably would like, and that there probably needs to be testing of fully vaccinated people coming through after they arrive. So at least in the first 5 to 6 days, and possibly also at 12 to 14 days. And that's because they may well be infected, don't know it, are asymptomatic, and may pass it on to other people who are within the population. So what we're also saying is that there may be an argument to still quarantine obviously the not vaccinated and the partially vaccinated, because they will be, of course, less protected. But I think the key thing, I guess, is that we're moving forward to a system where if we can get the vaccination levels up to, maybe the government will have to decide what level. We won't get to 90%, so I assume that we're going to get easing before we reach the 90%. So probably 75% might be the magic number. The government will have to agree that, and then allow first fully vaccinated people coming through. And when decide, which nationals will do that. Will it just be US? Will it be other nationals? And then figuring out all the things that we've just heard about from Laurie and Theresa, the logistics of it. How do you prove you're vaccinated? Which vaccines reliably, so that there's no fraud, there's no, there's a reliable system. I was vaccinated on Sunday fully. I got a cardboard document and a sticker. So we're going to have to do better than that if we're going to, get us going again. But we've got a long way to go. It is a complex issue. And the key thing really is to get these protocols right, because if we don't, we will see a surge particularly in the unvaccinated, but potentially in everyone. So I would say the science needs to drive the policy going forward.
Can I just get a clarification from you? On the fully vaccinated column, you have no 12 to 14 day test, but a quarantine still. Is that correct? Are you suggesting that in addition to not vaccinated and partially vaccinated, you need to quarantine, or is that a typo in terms of?
Sir, which one are you? Say that again, Robert.
Fully vaccinated travelers, do they need to quarantine? This column says yes, but I
got those swapped around. Yeah, it should say yes on the 12 to 14 day test, yes, and quarantine upon arrival. Well, they have to wait for no, actually that's not a typo. Upon arrival, when they do the test, they have to wait for the results. So they can't just, they may turn up positive, but after the test is negative, they should not need to quarantine.
Okay, so what we're suggesting is if people come in who are fully vaccinated, they do their test before their test at arrival, they need to quarantine until they actually get that, or self-quarantine until they get that test back in maybe 24 hours. And then after that, they could engage with the community, but they should be tested again at 5 or 6 days or 12 or 14 days, because roughly a third of all cases won't be actually identified through the border tests alone. So that's the proposal here?
That's the science. You know, it's 5-day incubation. You could get infected on the way to the airport or whatever. So having just a test upon arrival is actually not enough. So catching those incubating infections, and then for surveillance, I think 12 to 14 days would be great. And that could be done locally. It's not like you have to, you know, we have the capacity to do that in Canada. I don't know what it is in the US, but those are inconveniences for sure. But we are trying to move towards a risk-based system where we need better data. So if we're not testing people thoroughly and every traveler, and I don't think we're anywhere near that, we won't have that data. The other thing I should mention is we should get rid of these exempt categories and just fold them into these 4 categories. And I agree that it has been, you know, very untransparent on who gets exempted and who doesn't. Why would we need to exempt people if they're, you know, they're one of these categories and we treat everyone the same? I think that's really, there may be a small number of people, but they could easily get vaccinated fully, and then they would be fine to move back and forth frequently. But these exemptions are a big problem.
Right.
Okay.
Thank you. So we've actually talked about the challenges and the costs of the border restrictions, some of the sort of planning issues on it, some of the health challenges that need to be considered. And now I'd like to invite Hugh Lloyd-Ellis to give his perspective in terms of, well, what could the downside be if in fact there are new variants beyond the Delta or the Delta Plus that are more dangerous, the kind of the partial escape variant that could really in fact spread and potentially hospitalize people, even including some who are fully vaccinated. Hugh is professor of economics at Queen's University and also the academic economic advisor for Limestone Analytics, which has done some of the most thoughtful and insightful economic analyses of the implications of COVID over the last year in Canada. Hugh, over to you.
Thanks, Robert, and thanks for the invitation. As a lot of people, as was just discussed, actually, particularly by Laurie and Theresa, one of the biggest problems in thinking about how things will evolve economically is the lack of a clear plan of how things might arise. So one of the things we're going to be looking at here is, we're going to devise our own plan of how things will adjust, consider alternative scenarios, but we don't have a lot to go on at the moment so far. So the second thing I should point out is that I'm going to focus at a fairly macro level. This is not a sort of microeconomic analysis. So we have to take into account a lot of facts, not just the border restrictions and their impact. So although of course that plays a major role. So let me, to see what I'm talking about, let me just share my screen here. See how this works. And sorry. Okay, so can you see that, Robert?
Yeah, looks good.
Okay, good. So just to state some obvious things, Canada is clearly being held back by current COVID-19 restrictions, and especially this summer, given the nature of the types of industries that are impacted the most in terms of jobs, at least, border restrictions will impose major costs, economic costs this summer. And as we've seen, other countries, especially the UK and the US, have relaxed restrictions and they're experiencing an economic revival. So one question is, why can't we in Canada? The COVID-19 case counts have fallen dramatically, as we know. And as we just saw, the first dose vaccinations in Canada exceed those of other countries. But of course, as we just mentioned, we're not there yet. In Canada, the full vaccine rate is not, the double dose rate is still less than 30% as we speak. And the variants of concern are on the rise worldwide. So I just want to, I had a few slides here, but I think Kelley kind of covered a lot of these issues. But just to recap a couple of things quickly, we're already seeing in the UK significant movements in the upward direction of daily new cases in the last few weeks. And that's obviously worrying. And as has been mentioned, this is largely being driven by the Delta variant in certain areas of the UK, and especially where it's just taken over. So these are kind of scary pictures, I guess. But even in the US, where there hasn't been that significant uptick in cases, the Delta variant is becoming a big fraction and a rapidly increasing fraction of cases. So these two graphs here sort of illustrate that both time series. This is from the CDC's website, showing the Delta variant, which is the B.1.617.2 that I've highlighted, is growing rapidly. And there are certain regions of the US where it is already the major variant that's affecting overall cases. So a question that's always been at the back of people's minds, I guess, throughout this pandemic is whether the extent to which at least maintaining restriction at a point in time might pay off later. And so there's suggestive evidence of this looking back at the US 1918 flu epidemic. Some work that was done right at the beginning of this pandemic sort of highlighted this, that cities that imposed strong restrictions early on in that flu pandemic benefited from greater manufacturing employment growth subsequently. And this is still a crucial question in 2021. And it all depends, of course, on how fast different industries, different sectors can recover, and the various interconnections along the supply chain that slow that process down. We've already seen that in a lot of parts of the economy, there are supply chain issues even as economies recover. And of course, it also depends on the seasonal nature of economic activity. So we've been working with Limestone Analytics and some other academics at Queen's University. We've been developing what we call the studio model for Canadian provinces. And this is basically a kind of planning tool that is intended to help quantify the economic costs of different scenarios. So we can't predict the future. I don't think anybody can, especially in this context. And so we've developed a model that allows us to think about what the relative costs of different economic costs of different scenarios might be in terms of both the value of production, GDP, and the jobs that are created in those industries. So this studio model, which stands for short-term undercapacity dynamic input-output model, is basically a model that's intended to look at very short-run information as it becomes available, and it tries to account for what's going on in different sectors of the economy and how they interact over time. And in particular, for this analysis, we're obviously considering the effect of different kinds of demand changes. And a lot of those demand changes, a big factor in a lot of sectors in the economy, are those related to foreign tourism and travel. So in particular, accommodation and food services, entertainment sectors and recreation, and obviously transport sectors of the economy are affected in a large way by those restrictions on the border. So just to point this out, this is a quantitative model that tries to essentially put dollar values on different situations, different scenarios, and uses information from Statistics Canada, standard sources like the input-output tables of Statistics Canada, Labour Force Survey, and then we compare everything to what might have happened in the absence of COVID. So we've got a sort of counterfactual path that the economy would have taken, and it sort of varies, obviously seasonally. So we account for seasonality in that way. And an important, obviously, component of this is sort of the epidemiological forecast that we take as given in thinking about this. So what drives this model, or estimates based on this model, are epidemiological scenarios. So we consider here some alternative scenarios for the remainder of 2021, and these are based on, actually Kelley just mentioned that some of the work by Caroline Colline at SFU, and these alternative scenarios are based on the modeling scenarios from her group. And in addition, we basically assume the restrictions that are going to be imposed or relaxed in response to cases do so in a similar way that they did in the third wave that hit Canada. And that's just an assumption we're making. Of course, that doesn't have to be true, but that's the process we're looking at. So here we look at several different alternative scenarios. The first two relate specifically to the summer reopening plans we might expect during this summer, and we're ignoring at the moment the potential for the variants creating problems. So we think of it, we're just basically comparing a rapid reopening after mid-June and versus a gradual reopening where sort of phase 1 restrictions, this is Ontario we're focusing on to start with, are in place till the end of August. And associated with that are the restrictions on the border, and we're assuming in this no more lockdown scenario that there's going to be a gradual relaxation of restrictions, and the impacts that that has on different sectors will take place over a period of time, but be fully relaxed by September. Whereas in the gradual reopening, the border restrictions don't really start to be relaxed until after September. And we also assume in these two scenarios different things, but in the first scenario, the vaccine rollout is assumed to be sufficient to keep the Delta variant in check. And as Kelley mentioned, that's likely to imply at least 90% fully vaccinated. And we haven't been particularly clear about that, but we're assuming that. And then the other case in this example is restrictions that are combined with the summer vaccination rollout, whatever that is, are going to be sufficient to keep the Delta variant and other variants in check. So this is the kind of sort of dynamic path that we might see as a result. This is just aggregated across all the sectors. Obviously, I can't go into all the details here, but that's the kind of modeling here. So this shows the impact relative to what would have been expected the economy's path to be at this time based on forecasts prior to the COVID epidemic even occurring. So this is the sort of net cost. And so you see there's obviously a difference in these two paths. And then we compare it to scenarios where we include the rise of the Delta variant or other types of variant along those lines. And essentially, we're basing the timing of all of this, as I said, on the forecasts or the epidemiological modeling of Caroline Colline's group. So in these cases, we've taken a sort of intermediate kind of a reopening process that starts around mid-July, so it's pretty soon. And the border restrictions do get relaxed fully by September. But in one case, the speedy second dose case, the 75% of people are fully vaccinated by the end of July, whereas in the other case, that's only true by the end of the summer. And the speedy second dose is pretty optimistic, but there is a high rate of vaccination going on right now, so it's I guess it is a possibility. And we look basically at the implications for the types of lockdowns that might arise if the Delta variant becomes significant and has the same effects on cases or similar effects on cases as we've seen in the third wave of the Alpha variant, and the resulting kinds of lockdowns, which in this case we'd anticipate happening in the fall, around about starting in November. So this is the, again, comparing these different time paths. That's the kind of analysis we're getting. You can see that there are obviously very significant impacts potentially on the downside associated with that continued spread of the variant, especially in the fall. And then, as Robert mentioned, another type of scenario where we focus on here is partial vaccine escape, where basically some variants arise that essentially our vaccinations are not fully able to deal with. Our immune systems aren't able to fully deal with, even if we're fully vaccinated. This is partial escape, so it's not full escape, which would be obviously a lot worse. And we're basing these estimates again on the type of scenarios considered by the epidemiologists. And so you can see there's these two cases depending on whether we get to this 90% fully vaccinated, and we basically said by the end of September. This is the the suggestion versus 75% by the same time, following similar relaxation of restrictions in the cases that I just mentioned. So again, these scenarios obviously are based on a lot of guesswork, a lot of uncertainty, but these are the kinds of estimates that we are finding based on what's happened in the past, combined with what these scenarios suggest might happen in the future. And just to give a relative comparison, this graph here shows the period going back to the beginning of the pandemic. So you can see that, just to give you a relative size of the impacts in Ontario compared to the first major impact in April and May of 2020. So these numbers are just essentially comparing the various scenarios with the initial scenario of no more lockdowns, which is kind of the most optimistic scenario. And we'd actually look at not just Ontario, but all the provinces in Canada. So the Canada part of the table is here is aggregating across all of those. And in the pictures I've just shown GDP, but here we've also got the full-time equivalent job losses. And on the percentage side, they're basically the percentage of the annual levels in each case. And so you can see, in particular, the main point of these numbers essentially are that, the gradual reopening relative to the not having any more lockdowns and rapidly removing restrictions at the border, in particular, is costly. But when we start looking at the costs involved in some of these other possibilities, these become much larger because of these big impacts in the fall of 2020, big potential impacts. And of course, some of these are extreme. The partial vaccine escape at 75% would be a big impact, and perhaps maybe a little unrealistic, but it gives us a sort of worst case scenario. So I tried to get through that fairly quickly, so hopefully it was fairly understandable. But the main sort of conclusions here is to point out that it's true that the maintaining restrictions on economic activity, especially border restrictions, is going to impose significant economic costs this summer. But in terms of the dollars, the downside risks associated with rapid reopening are potentially substantial. And there's a lot of uncertainty, there's extreme uncertainty about how this epidemiology will play out. Some people are arguing now that the Delta variant, for example, isn't as transmissible as some other people feared. There's a lot of debate apparently about this. I don't know much about that, so I won't go into it. But the economic costs in the fall could potentially far outweigh the gains of reopening during the summer from Canada's point of view. And of course, these economic costs that I talk about here don't account for anything beyond the end of 2021. Of course, those paths would have continued on after that. They don't involve any of the health issues that are obviously a major cost. These are just economic production costs that we're really looking at. And it doesn't include any of the long-term impacts of potential school closures in the fall if we end up in some of those worst situations that are discussed there. So that's a concluding remarks. Thank you.
Well, thank you very much, Hugh. And the four panelists have given us a really good overview of some of the key health, operational, economic upside and economic downside implications of reopening the border. So how to really tie together all these different elements? Fortunately, to provide an initial perspective on that, we have an extraordinarily experienced, distinguished former diplomat with a deep understanding of Canada-U.S. relations, Colin Robertson, who is Vice President and Fellow of the Canadian Global Affairs Institute in Ottawa. Colin, when you look at this, if you were trying to synthesize in 5 minutes for the Prime Minister's office or for the Minister of Global Affairs, how to weigh these different elements, what would you take away from this?
Well, Robert, I'm reminded, first of all, I feel like I've just been tossed out the window without a parachute with what you set me up for. But early on in my career, I worked for a politician, Alan McEachin, who used to get a whole series of briefings like what we've just had. And he would turn to me at the end, because I was his legislative assistant. I was allowed 1 or 2 words to sort of summarize what had been said, because we'd had this series of briefings. And so here is my sort of summary before I get into what you then asked me to do, which was sort of give a bit of the kind of what's the politics behind all this right now. In the case of Lori, plan. There isn't one. In the case of Theresa, engage. Part of the problem, of course, is we got a brand new administration, and some of the players who we would normally deal with simply aren't there. For Kelley, underlining the key importance of vaccination and risk management, looking at the risks involved. In the case of Hugh, he's certainly well described the costs, but he's also underlined the need to forecast, and he presented a series, but he also, with the strong caveat, the great deal of uncertainty that still surrounds what we're dealing with. So that would be my kind of summary of what we've just heard, without doing them justice, of course. And you've asked me also to look at sort of the politics and public opinion. Well, in terms of the politics, the Canadian business community is increasingly vocal about reopening. Big business has done workarounds. So for them, it's in some ways more esoteric than real. The supply chains for things like autos and manufacturing are getting the goods back and forth. And they've been doing the workarounds for inconvenience of maintenance, training, and marketing. But quarantining after trips is becoming inconvenient. And I think it's worth pointing out here, Lori's observation that this has particularly hurt small businesses and those who the government in Canada and in the United States are trying to lift up, that is racial minorities, women, and small business. And so I think that this stuff will be lifted. Small and medium-sized business depend more on face-to-face. And so you got the Chamber, the Canadian Federation of Independent Business, and the Canadian Exporters Association all pushing to see the reopening. The tourism industry, again, as Lori pointed out, wants to reopen because 2 years in a row, and they're really hit badly. The pressure from the United States has come from border state congressmen reacting to Congress, to constituents whose livelihood and leisure depend on open border. I'm in regular contact with one woman who's got a cottage in Canada, and she hasn't been able to visit it for 2 years. And I think Theresa pointed this out, the case with what her sister-in-law was trying to do. Congressman Brian Higgins has led the charge, but he's also had support from Chuck Schumer, the Senate Majority Leader, who has other bones to pick with Canada on things like dairy and the rest. The premiers are divided, and I think this is a critical piece, because it looks like weeks, if not some months away from an election being called federally. The Atlantic increasingly favor opening, and I think Premier Horgan in British Columbia, who had been against it, is now leaning that way because of the risk that the Vancouver could well lose the billion-dollar cruise liner traffic that would simply drop Vancouver and just sail from Seattle or Portland all the way up to Alaska. But Premiers Ford and Legault, the two biggest provinces who got burnt from the open border or more open border in the past, are worried that as the U.S. has not reached the 70% threshold, and I think Hugh pointed this out, as did Kelley, is that the vaccine hesitancy in the States, that we could be in for a double shock if we open the door to more trouble. This varies across the state and country with, as we pointed out, rural or less vaccinated. With the election likely to be called in August or September, there's a lot of pressure on Trudeau to change. There's not really much pressure on Trudeau, I should say, to change the status quo. So I'm not so sure that July 21st is going to be the date. I think they may make some changes on the 21st, but as long as the premiers are not all in alignment, keep in mind that the premiers and the prime minister, we have this new variation on how you manage federal-provincial relations. They talk every Thursday night, basically around COVID, but increasingly they've been talking about other things as well, including the opening of the border. So I think they're going to have to come around to it. I also see no pressure from the United States, that is from the President of the United States, to reopen. I do see from constituent interests along the north, as I pointed out, but not beyond that. Public opinion polls have been consistent in supporting the closed border approach, although as Canada regains control over the third wave and increases the vaccine rollout, and with the United States making even more progress in its own vaccinations, although to a certain point, the concerns Canadians have about reopening the border is dissipating, as long as there are adequate measures, again, underlined by the other panelists, on things like ensuring that people who come in are vaccinated with proof and a vaccine passport. And I thought Kelley brought it home with showing those two little pieces of paper. I have an email from Quebec and I have a photocopy from Ontario showing I've had my double jabs. But is that really going to pass scrutiny at the border? I don't know. The turnaround is pragmatic. The economics, tourism, supply chains, and the economics of border shutdowns, is the cost side of it. So there is sympathy, and there's also some sympathy for bringing together friends and family. Sadly, and I think this is really where I'll stop, and this takes me back to Theresa's point, the bureaucrats in U.S. and Department of Homeland Security and Canadian Border Services Agency have not been able to agree on vaccination certification. Laurie's been pointing this out to me for weeks now. CBSA has got their own route using the CanPass app, but the Americans aren't agreed to it. I had hoped that something might come out of the G7, where there've been talk about the health ministers getting together and agreeing on something that the West would apply, because you do want to see tourism, but I don't see any sign that that's happened. So I kind of conclude by saying we're still up the creek without the paddle, and the forecasting is, as Hugh said, great deal of uncertainty. Robert, back to you.
Well, thank you very much, Colin, and what a great overview from all of you. I'm inviting all the people listening in to put their questions into the Q&A. And there's one that came out specifically, Kelley, for yourself. When you mentioned the elements of the test, one of the people listening asked, well, that could cost $200 a pop. That's $400. That's actually going to be a lot for people who don't have a lot of money, or is the idea that this would be paid for by the government using present underutilized capacity? What would your perspective be on that?
Yeah, and I appreciate the cost for sure. And certainly there's been so many inequities that have been created by putting travel restrictions into place. But as we ease them, of course, there's also further inequities that we're revealing. The cost of the tests, I think it will come down, it's a political decision, I think, really, about whether it's an economic right or a social entitlement to travel. We have to decide, who's got a right to travel and who doesn't, or who's, we need to, I guess, look at ourselves. Is it a right to go to your cottage in Quebec? Is that your human right, or is that an entitlement? And so who pays that cost? Is it the person that's traveling, or is it the government? Is it taxpayer? I mean, those are political decisions, but I appreciate it is expensive. I'm sure that the testing companies could reduce their costs. I think there's some, thriving businesses being made at the moment through testing. I think the governments on both sides of the borders could get those costs down. And I think that would be the way forward. But I think there are certain, obviously, categories of people who have to travel. They would probably need to be put in some special category. But the testing costs are high, but the cost of not testing is even higher, as we heard from Hugh. So I think we do need to get this right. I think it should not come down to cost. It should come down to the need to test and, to keep everyone safe. So.
Right. Well, let me invite the panelists to sort of, if they have any comments. And Laurie, because you've been listening to all the other panelists since, do you have either some comments, observations, or questions for your fellow panelists?
Oh, there's a lot to talk about, a lot of great stuff. I guess a couple of points that hit home with me were, the lack of alignment. It might have been Kelley's slides where the CDC requirements were put up and the, Canadian requirements were put up. And never shall the two meet, because even the CDC guidelines are guidelines. They're not really policies. I mean, the U.S. does not have a quarantine requirement. All we really have is a pre-test requirement in the air mode right now. So, I just don't see that alignment happening. And as Theresa pointed out, these restrictions have been different the entire time. They've been different by mode. They've been different by the definition of what's essential. They've been different by what's required. And so we are on two different paths. We've been on two different paths. We are going to continue to be on two different paths. The United States has made it very clear that at the land border, they have no intention of getting into the business of verifying vaccines. Customs and Border Protection doesn't want to touch that. So even if we have some sort of bilateral plan, it's not going to be the same. So I think that's an important thing to keep in mind. And then something else, a lot of us have been frustrated, and Theresa pointed this out, and Colin pointed this out, of who's holding this file and who's talking to who. And I think in the United States, it's not really clear right now who is going to make this decision. It's in the White House, but there's multiple agencies within the White House who may or may not be sort of involved in these conversations. And then I don't think we can underestimate the the slowdown that we face with the new administration, because there was conversations happening, believe it or not, within the Trump administration, and all of those plans and conversations really got pushed out the door, as any new administration and most countries does. They throw out what's been done and they start over again. And we had to confirm our first actual Secretary of the Department of Homeland Security in years. We didn't have an ambassador to Canada. I mean, these really, really key pieces. So that's another thing that has slowed down the process. And I don't know how clearly that's been communicated to, again, people that are every day impacted by these restrictions and don't understand why this process has been so murky and such a mystery.
Great points. Who else would like to come in here?
Oh, if I could just follow on to something Lori said. I mean, and Colin is very much aware of this, there's always been an asymmetry in the relationship between Canada and the United States in terms of the attention that Canada wishes the United States paid to Canada and the attention that the United States actually pays to Canada. And I think it's worth noting that all of the major players in the Biden administration who would be in charge of negotiating this reopening with Canada are also dealing with the domestic COVID-19 response and unaccompanied children at our US-Mexico border, and a lot of other things. And so this, frankly, hasn't reached the level of crisis that they feel like they have to really engage. Domestically, politically, the US-Canada border just doesn't carry that same weight. Our Congressman Brian Higgins and Chuck Schumer notwithstanding, Colin is right. There's no one screaming fire at the White House on this. There's no one I don't think there's anyone screaming fire at Homeland Security on this, or at State Department, or at HHS. Until that happens, it's going to be, I think it's going to be difficult to get the kind of engagement that is necessary to have a good bilateral conversation. And that is a constant issue in US-Canada relations that we always deal with. I do think that the science is unclear, meaning, as Kelley said, we might have been on a trajectory to reopening, but these variants are throwing a monkey wrench in the whole scheme, right? I think there probably was an avenue there, but now we have another variant and we don't exactly know how vaccinations work against it. And we don't exactly know, now there's questions about, if you got 2 jabs versus 1 jab, are you more or less safe? All of these things make it very, very difficult to do the kind of planning, but it's not impossible. You do scenario planning. You say, what are our trajectories? What are our tripwires? What are the things that would allow us to go to the next level? And what would that look like? The other thing I think we all need to try to figure out how to do a better job at is conversations around risk with our population. What's an acceptable level of risk for this disease that is going to be with us in perpetuity in some form or another? At what point do we have it enough controlled or managed that we can continue with our lives and accept the level of risk it involves? I think that as societies, particularly with the severe response that we had to this COVID-19, we've taught our population to have very low tolerance for risk. Mm-hmm. And I think we have to understand that I also would say I would not put our border officials in charge of figuring out what's an acceptable vaccination passport. How long did we have to negotiate on the Western Hemisphere Travel Initiative about what's acceptable border crossing documents? We'll never get there. If the vaccination document is evidence just to get you out of additional requirements, but you can still cross if you don't have that, then the validity of that document is less, I would say there's less of a risk if somebody having a false vaccination certificate. If you can say, you know, if it's not this level of a certificate that we can trust, then you're still going to have to do these other things, right? There's alternatives. That's not the same as an identity document, for example, for travel. So, but our border agencies tend to think in those kind of identity document terms, and I think we ought to look at something different. But I'll stop there because probably plenty of commentary.
Well, one other question that is being raised is, could there be a regional approach? You know, does it need to be a national to national? Could one imagine an approach, for example, around the Vancouver sort of Seattle link, or maybe by certain sectors, or does a regional approach, is that a non-starter?
Well, I think we should have a regional approach, and I think we should do pilots. I mean, Lori, I'll let her speak to this because she's been working on some of these things. You know, think about it. Our border is the longest border in the world. It's longer than going from Beijing to Moscow. And I took the Trans-Siberian, and that took me 10 days. You know, this is a huge border, and there are huge variations. We're not talking about Europe where you've got you could plunk all of Europe into parts of Canada. I do think that pilots, and I do think regional approaches, and also our border crossings are quite different. You've got Windsor, Detroit, huge tracklets and things. Then you've got Sweetgrass and Coots in Alberta and Montana, where basically it's local people going back and forth and where they want to share the vaccines. Lori, I pass to you.
Well, thanks, Colin. I mean, I think a regional approach in theory is great, but I don't think there's really an appetite on the part of CBSA or CBP to actually implement that kind of approach. Now, pilot projects is where we can make, I think, some headway, as Colin highlighted. We pushed back in the fall of last year to do a pilot project using Nexus and saying, hey, if I have either, at that time it was negative tests, now it could be vaccination. If I can voluntarily share that through my Nexus portal with both governments, and I scan my RFID card, I have very little contact, if no contact at all with the border officer, you know, we should be testing that out to see if it works. And to Theresa's point, you know, if you're a Nexus card holder and you present any false information and you are banned from Canada or banned from the Nexus program, I mean, that right there is a check. And somebody in the chat raised the point of, have these conversations been shared with government? I mean, yes, we have. We shared it with both governments. We shared it in high-level conversations. We shared it multiple times. We shared it with our local port directors. And there was interest, and it was feasible from a technical standpoint. At the end of the day, what we were told is, it's too complicated to do something like this with the Nexus program because it's a bilateral program and you have to get both governments to agree. So that's what we were up against. And granted, this was last fall, so it was in the midst of the US election. But I absolutely think pilot projects are the way to test these things out. Kelley mentioned, you know, we need more data. We need to understand who might be vaccinated and then test positive. And we should be doing these pilot projects. We should have started them months ago, and then we would have that data now for fully vaccinated travelers. And, you know, even if we can't begin those until this summer, it's better late than never, because I do think that information is very valuable, and it also gives people a way to be able to move back and forth in a very controlled environment.
Let me just throw out one specific element for the pilot, which cuts across what a number of you have been saying. This idea of actually identifying certain groups of Americans who are fully vaccinated, whether they're Nexus card holders or whether they actually have property in Canada or family in Canada. So it's a subset. So it's but a significant enough pilot. Do you think there would be an openness on their part to come into Canada on the condition of those tests, doing a test at 5 or 6 days or at 12 to 14 days, which could be either going to a local testing center where there's now plenty of capacity in Canada with the waiting of the third wave, or it could be, I imagine, a mail-in test. But it would provide that full sentinel surveying, so we'd really know how well that's working, what degree there were breakthrough cases, whether the breakthrough cases were of variants of concern. How realistic do you think that is, Lori or Theresa?
So one thing I would say is that, we talked about a regional approach, but I think it's more likely that phasing in will be by population, exactly as you described. We've already segregated the population by the purpose of travel, right? Essential workers are essentially not required to do any of this. And we are accepting, as you mentioned, we're accepting that level of risk. So then you have to say, well, what's the additional risk of allowing, fully vaccinated family members or property owners? I think, the key here is you have to be able to stay in Canada long enough for the testing and the quarantining and the response. So it's not going to affect casual travelers. It has to be somebody who can spend 2 full weeks at a location in Canada to be able to do that. And that limits the population in and of itself. Even if you're talking about family members, you're not going to have day travelers. You're not going to have a big vacation tourism industry for anybody that would just normally stay 5 to 7 days, right? It has to be a full 2 weeks. And Americans, frankly, just don't get as much vacation to be able to do that.
Right.
So I think that, that could be an approach, is that by phasing it into those populations, it's going to be self-limiting by who has the capacity to be able to do that. And as the previous questioner taught, who has the resources to be able to pay for those testing and things like that. But yes, it would give you more data. But I also say you don't have to rely on travelers to get the data. You can get the data from your domestic populations. If we're looking at breakthrough vaccination rates, it doesn't matter whether that person traveled across the border or didn't. That's about the vaccination and whether or not it prevents onward reception of the COVID vaccine. We should be testing as much as possible in our domestic populations to get that data to apply to the cross-border travel.
And Theresa, let me just come back to the question of essential travelers or exempt travelers, because in the advisory committee report that was referred to earlier, it was completely ignored. They explicitly didn't actually address what they should be doing with exempt travelers, because the view was, well, they're essential, so they should just keep on doing what they're doing. But I think
nothing.
Well, the world has changed. Why wouldn't? Let me ask. Why wouldn't there be a requirement that exempt travelers are fully vaccinated in July 2021? Is there a reason that we wouldn't be putting that in?
Again, I think, one question is, has there been effort made to make sure that those who are considered essential, particularly for business cross-border travel, are being vaccinated, right?
Oh.
We don't know the percentages. I don't know. But I think my point in talking about the exempt travelers is that we talk as if our border has really been shut down. And it hasn't. It hasn't even been shut down as far as it was after 9/11. The amount of cross-border travel that's considered essential is still very substantial. And that's been going on this entire time. The entire time.
Right.
What has been the risk of that? Have we seen lots of cases? If we and yet our governments found that acceptable. And so that's what I talk about, risk, understanding risk and evaluating risk. We said that was okay because the risk of doing that was, okay because of the benefit of the economic, benefit of continuing that cross-border travel. That was the decision that was made. It was a political and policy decision. And both countries sort of accepted that. But the language, for most Americans, I'm not sure they understand how much border crossing is actually still happening.
Yeah.
I think they believe that it's mostly closed down, but I think they don't understand how much is actually happening. And so that's what I mean about, understanding and assessing risk. What really is the risk of starting to open up? And is it more than we've got right now with this flow of people back and forth that is not undergoing any of this right now?
Well, it's interesting because what is clear is there's a multiplicity of different issues. It sounds like there's a path forward that would be based on science and a kind of a July 2021 assessment of risk by population groups with some thoughtful pilots would allow us to move this forward perhaps more quickly than is likely to be the case, because I think the panelists have noted that there's not a lot of political will on either side of the border at the national level to move this forward. And it doesn't look as if the governments themselves are organized enough compared to the all hands on deck after 9/11 to really resolve this. So, the idea that, governance is too important to leave up to government I kind of wonder whether this isn't a conversation we need to be continuing in terms of what can we concretely be putting forward as concrete suggestions to our two governments to move this important issue forward. I think we've had a great overview of the opportunities, the challenges, the downside of getting it wrong, but also the human as well as economic benefits of getting this right. But certainly I take away from the fact that we shouldn't assume that this is going to happen unless all of us here and all of us listening to continue to push on both sides of the border to move it forward. So I'd like to thank, on behalf of the organizers and the audience, our 5 esteemed panelists for this tremendous conversation. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.